Hello, I'm John Broom with the Dalhousie Medical Research Foundation. This is part of a series of updates on some of the research taking place at Dalhousie University as it relates to the COVID-19 pandemic. Even before the current crisis became our reality, studies indicated that mental health disorders already affect 1 in 5 Canadian youth, making them the most common source of illness among children and teens. Getting the right care to youth and their families at the right time is essential to prevent serious complications, including disruption of education, lifelong disability, substance abuse, and many other dire consequences. Today, I'm pleased to present an instant interview with Dr. Jill Chorney, Associate Professor of Psychiatry at Dalhousie University, and a psychologist and advanced practice leader in behavior change with the Mental Health and Addictions Program at the IWK Health Center. Dr. Chorney, I understand that you and your colleagues had already been doing a lot to address wait times for children and teens to access mental health services in our region. Now that we're facing increased challenges as a result of the pandemic, what does the situation look like now for youth who are having difficulty coping with everything that's going on in the world?
Well, we definitely know that what's going on in the world right now has implications for the mental health of youth and their families. We know that some of the risk factors for mental health concerns are ever present in our environment right now. These include things like economic stressors, uncertainty, physical health concerns, trauma, or even just not having access to the typical positive ways of coping, like going out and being with friends. We also know that families are under stress right now. Many are trying to figure out what living under social isolation looks like and feels like. This could include new or ongoing educational, economic, or relationship stressors that can all make things more difficult for youth and their families.
What are you and the IWK Mental Health and Addictions team doing right now to try and help?
It's important to know that the IWK Mental Health and Addictions Program is still here for our youth and our families. We've transitioned all of our staff to working remotely, which means we're offering what we call virtual visits to our families. That means that they can connect with their healthcare providers through phone or through video conference in a place that's convenient for them. And shifting our entire program to providing care in a virtual environment has been a big task, and we're really invested in making sure that what we're doing is still helping our youth and families. What this means is that we're wrapping research into everything we do. We're learning more about how we can best provide care in this current context and the implications for this for our youth, their families, and our staff.
Do you have any advice to offer to youth or the parents of youth who are struggling even more than usual right now?
Yeah, first I would say know that it's normal to feel a little unsettled during this time. There's lots of things going on in the world, lots of unpredictability, and a shared human experience right now is feeling a little bit unsettled and a little bit nervous. There are lots of recommendations to help during this time, things like keeping routines and trying to stay connected to people around you in a virtual way. Even with physical isolation, we try to encourage people to stay connected with the supports that they have and to be able to reach out to those supports that are available. So if in need of mental health services, the IWK is still here and can be reached through our central referral office. And Kids Help Phone is also another excellent resource that's available 24/7.
Thank you very much, Dr. Chorney, for sharing your insight and expertise with us.
Thank you.
If you'd like to find out more about the COVID-19 research DMRF donors are helping to support, please visit dmrf.ca/coronavirus. And if you have any questions or concerns you'd like to share, or if you'd like to help, we'd love to hear from you at dmrf@dal.ca. Thanks for watching.